Hi, my name is Lynette Manette. I'm going to be the nurse practitioner for you today. How are you feeling?
I'm okay, Lynette.
Good. So first things first, can I verify your name and date of birth?
Yeah, John Davis, 1993, January 20.
Perfect. That matches our records. So in the last few days, have you had any recent illnesses? Have you been coughing or anything?
No, not that I think of.
Perfect. Good. So with your permission, I'm going to go ahead and do a respiratory assessment on you, which involves an inspection of your chest, palpation, percussion, and auscultation. Is that okay with you?
Yeah, that's okay.
Okay, perfect. So first things first, we're going to assess your chest, make sure that everything looks symmetrical in this anterior position. Chest is rising symmetrically, his trachea is midline. There is no sign of him using any accessory muscles for breathing, any abdominal muscles used for breathing either. He has no signs of cyanosis, no pallor, everything is within normal limits. So now I'm gonna have you go ahead and go to the anterior posterior side. And just how you saw in the anterior, there is no sign of any barrel chest, there is no kyphosis present. So we're gonna go ahead and continue with our assessment. Can you turn over a little bit more for me? Perfect. So the first thing that we're gonna do is gonna go ahead and palpate his back, make sure that the chest is rising symmetrically. We're gonna go ahead and find the 10th vertebra. Perfect. So when I tell you, go ahead and do a full inhalation for me so that I can go ahead and make sure that your chest is rising symmetrically. Go ahead. Perfect. My fingers are moving outward. The distance is greater than 5 centimeters and they're both symmetrical. Perfect. Sounds good. So now we're going to go ahead and move on to percussion. And the way that we percuss, we use our middle finger of our non-dominant hand, and then we use our middle finger of our dominant hand, and we go ahead and tap right under the nail bed, not on top of it. I'm going to use these landmarks as well for auscultation. Perfect. So we did go ahead and hear resonance throughout his chest. We did hear a little bit of dullness towards the organ liver part of his body. And now we're going to go ahead and do auscultation in these same landmarks. We're just going to go ahead and listen with that same ladder side to side auscultation pattern, and we will hear if there are any adventitious sounds or if his lungs are clear. And we use the diaphragm of the stethoscope. Are you doing okay, sir?
Yeah, I'm okay.
Perfect. So we're gonna listen to a full breathing cycle, which is an inspiration and exhalation. Perfect. All his lung sounds are clear. There's no sign of any adventitious sounds. We did go ahead and auscultate some vesicular breath sounds in the outer region. We did go ahead and hear some bronchovesicular breath sounds. And then over here, we did hear some bronchial sounds. And that concludes our respiratory assessment. Thank you.